interesting thing you were talking about the other day too. Of course, we all know that the drug problem is definitely going on here in BC. It's been coming along for a very long time. I saw you post this press release the other day, a joint statement from Claire Ratty of the Skeena MLA, also from you, from Prince George Mackenzie. I think, was Sheldon Clare on this one too?
No, just Claire and I. So
Just you and
Claire
Claire.
is our critic for mental health and addictions, and of course, I have a role in our caucus as the critic for labor. So the coroner's report comes out every month, and unfortunately, we've just seen these grim statistics time and time again
Yeah.
of people who died from the overdose toxic drug crisis.
Well, this percentage is what really got me. 22% of all known drug deaths are among workers in trades, transport, and equipment operators. So, of all drug deaths in BC, almost a quarter of them are in the trades.
Yeah, so that was actually the first time that the coroner has released those occupations along with it. So that's why this was significant news. And just points to the fact that we need to support BC workers. We need to make sure that they do have help. We need to make sure that treatment and that support is there. We've focused so much on, free drugs. The NDP is focused on that, that so-called safe supply. Well, that's not actually what's going to do it. We need actually to refocus back to prevention, treatment, enforcement, and then there's a role for harm reduction, but it can't be in isolation. That's all we're pushing and thinking that's going to make the situation better. But we need our workers to. These are people who build our homes. These are people who obviously transport our food, and they're struggling. So that deserves a call to action in itself to make sure that we're actually reaching that population. They shouldn't be doing this alone. They need to know that these are our brothers, sisters, aunts, uncles, neighbors, you name it. So we need to make sure that we're supporting them.
100%. I mean, one of the most insane things that I saw in the past couple of years here was our government putting provincial dollars into vending machines for
Oh,
drug paraphernalia. And then I watched that go through the federal government, through the talks out there, and they said, oh yeah, we're not going to do this anywhere else. It was a failed thing, but we're not going to shut it down in BC quite yet. And they let that go on for months on end. And then just last month, we find out they're doing it in Ontario too. We now have drug paraphernalia vending machines in Ontario as well. I mean, this seems like it's a very simple fix at the end of the day. Number one, you're going to have rehab beds available for these people when they need them. Because when somebody decides they've hit rock bottom and they would like to get out, they need help now. They're not going to wait 3 weeks for that to happen. So we need those rehab beds, number one. You need mental health supports, number two. All those facilities we shut down in the 90s, we kind of need those back too. And then number three, you got to have that ladder for them to climb out at, and then have some type of work or something they can do on the back end, because society normally doesn't hire those people coming out either. It seems like it's a pretty simple path out, but all we keep doing is these little Band-Aid things that aren't even Band-Aids anymore. They're not even harm reduction, they're just further harm.
well, you might be aware that Dr. Barbara Kane has a petition that's been circulating for quite a number of months now on psychiatric care facility in Northern Health,
Yeah.
including forensic psychiatric care beds. So that's something, again, I called out in the legislature to really, we need that access to secure care. Northern Health for the entire region, for forensic secure beds, we have access to only 4 beds in Kamloops, if they're even available. That's the extent of the problem for that mental health support. And people who are in these situations, they need secure care. We can't expect them just to put them in the hospitals and think it's going to be safe for healthcare workers. We actually need a more secure facility for them to be in to help get them through their mental health crisis. So that's what Dr. Kane has done, some amazing work to bring attention to this, and I've continued to try to support that however I can. Because ultimately that's what we need. We can't have these individuals just on the streets. Ultimately that's costing They end up in ER. They end up our firefighters having to, or paramedics have to resuscitate them. We have tons of costs in the system, but really they need the actual to get to the root cause of the problem, and that's what that secure psychiatric care would do.
Yeah, we had Car 64, Car 61, whatever it is here in Prince George as well. I think that's an awesome program. I think that's something, yeah, I think that needs to be expanded. And if it could be connected with these rehab beds and with the mental health facilities too, I think that is the answer. So, one piece of the puzzle at a time. We got to keep going. Thanks for your work on continuing to fight that fight too.